One of the things you can do to rescue someone from the shackles of stroke is to ensure that they receive timely medical intervention. Brain is time when it comes to stroke. The longer you wait, the longer the brain tissue dies, and the more and severer the complications the person suffers. Stroke occurs in three ways. First is when a blood vessel feeding the brain ruptures. Let's say I have an artery feeding my brain right now from this side to that side. When for some reason that artery gets weakened and it ruptures up to here, this side of my head will not receive blood, and I can suffer the consequences of stroke. The second way is when a clot forms. For some reason, a clot forms in the artery and blood cannot cross over onto the other side of the brain. The third way is by the narrowing of the artery because of deposits of cholesterol or other substances that closes the lumen of the artery. Therefore, less blood crosses over to the other side of the brain. When that happens, the brain tissue suffers and dies because it's not getting nutrients, it's not getting oxygen, it's not getting electrolytes and all the necessary things that the brain needs to work. When this occurs, time is of the essence. The longer you wait without treating or taking the person to the hospital to receive timely medical intervention, the more complications the person develops. Because when the person gets timely intervention and is a clot causing the stroke symptoms, they could evacuate that clot or do things to break that clot down or up so blood can flow through the artery again. If it's an artery that ruptured, they can also do surgical intervention to repair it to save the person's life or decrease or minimize the complications that would have been suffered. Also, if it was a plaque or cholesterol buildup that narrowed the lumen of the artery and caused decreased blood circulation through the brain, they have a way to widen the lumen up so that adequate blood can supply the brain. Here are a few things to do if you suspect that someone is having a stroke. 1, ask the person to smile. When you smile, your cheeks go up together, they come down together. The cheeks move in unison. When someone suffers a stroke, their smile is no longer even. One cheek goes higher than the other. They may not even be able to smile for you at all. Number 2, ask them to point their 2 arms towards you. Check to see if one arm is lower than the other, or even if both arms are dragged down and they cannot be up. Number 3, ask the person to mention their name or repeat something after you. If they actually having a stroke, their speech would be impaired based on where the stroke is occurring. They may not even be able to speak at all. In case that happens, take them to the hospital as soon as possible. Like I said before, time is brain. The longer you wait, the more brain tissues die and the more complications they would have. So this is all I'm saying. When you suspect a stroke or someone close to you or near you is having a stroke, ask them to do these 3 things. First, ask them to smile. Wash their face for signs of asymmetrical cheek movement or no movement at all. Number 2, ask them to stretch their arms towards you and watch if one arm drops or drags behind. Number 3, ask them to mention their name or repeat something after you and see if they are dragging their words or they cannot speak at all. If that happens, I bet you timely intervention is the best way to rescue the person from the shackles of stroke, because stroke can have several severe consequences, not only on the person that suffers the stroke, but on the family. Let's say the person is a breadwinner of the family. The livelihood would be taken away, and the person may even lose their life if the person is not rescued timely. So I hope this has been helpful